Hello and welcome back. My name is Dr. Alan. In today's video, we are going to talk about Lyme disease, one of the most common tick-borne illnesses in the world. It is often misunderstood, and if left untreated, it can lead to serious long-term complications. We will explore what Lyme disease is, how it spreads, the early and late symptoms, how it's diagnosed, treatment options, and most importantly, how you can prevent it. Let's begin. Lyme disease is an infectious disease caused by the bacteria. Specifically, it is caused by the spirochete bacterium Borrelia burgdorferi, and in rare cases, it can caused by the Borrelia mayoni. It is transmitted to humans through the bite of infected black leg ticks, also known as the deer ticks. If caught early, Lyme disease is usually treatable, but if missed, it can affect the joints, heart, and nervous system. The disease is named after the Lyme, Connecticut, where a cluster of arthritis cases in children was first identified in 1975. Today, Lyme disease is the most common vector-borne illness in the United States and also occurs in Europe and Asia. People who spend time in wooded, grassy, or brushy areas are at the higher risk. Outdoor workers, campers, hikers, and pet owners should all be aware. Now, let's talk about the causative agent. The bacterium responsible is Borrelia burgdorferi, a corkscrew-shaped organism known as a spirochete. It is carried and transmitted by the exodes tick, the black leg tick. Ticks become infected after feeding on infected rodents or deer and can pass the bacteria to humans during their next bite. The tick must typically remain attached for 36 to 48 hours to transmit the bacteria. Lyme disease is not spread person to person. Instead, the infection occurs when an infected tick bites and remains attached long enough to transmit the bacteria. Transmission risk increases the longer the tick remains on the body. Early removal is crucial in preventing infection. Symptoms may appear between 3 to 30 days after a tick bite. The most characteristic early sign is the erythema migrans rash, which looks like a bull's eye, red in the center, surrounded by a pale area, and then a red ring. This rash occurs in about 70 to 80% of cases. Other early symptoms include fever and chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes. These symptoms resemble the flu and may be overlooked if the rash is not noticed. If left untreated, the infection can spread and cause more serious health issues weeks to months later. These may include severe headaches and neck stiffness, facial palsy or Bell's palsy, drooping of one side of the face, arthritis, especially in large joints like knees, heart palpitations or an irregular heartbeat, nerve pain, and shooting sensations. And it can also cause short term memory problems. Prompt treatment is essential to prevent these long term complications. Diagnosis is based on clinical symptoms, history of tick exposure, and lab test. In early stages, a visible rash and recent outdoor activity may be enough. In later stages, blood tests are used, such as ELISA test, detects antibodies to Borrelia. Western blot test confirm the diagnosis after a positive ELISA. It is important to know that antibodies may take a few weeks to appear, so testing too early can lead to false negatives. Lyme disease is treated with antibiotics, and early treatment leads to full recovery in most people. Common first line antibiotics include doxycycline, amoxicillin, cefixime, or cefuroxime. For severe cases, such as those affecting the heart or nervous system, intravenous antibiotics may be needed. The duration of treatment depends on the stage and severity of the disease, usually ranging from 10 to 28 days. Prevention starts with avoiding tick bites. Here is how. Wear long sleeves and pants in grassy or woody areas. Use insect repellents. Treat clothes with permethrin. Perform full body tick checks after outdoor activities. Shower promptly to remove unattached ticks. And remove ticks carefully with fine tipped tweezers, grasping close to the skin. Ticks are most active from April to September, so be extra cautious during those months. You should see a doctor if you have been bitten by a tick in high risk area. You develop bull's eye rash or flu-like symptoms. You notice joint pain, facial drooping, or irregular heartbeat. Early intervention can make a big difference in preventing complications. Let's clear up some common myth. Number 1. You will always see the tick. Fact. Ticks can be as small as a poppy seed and often go unnoticed. Myth number 2. Only ticks in forest can cause Lyme. Fact. Ticks can live in backyards, parks, and grassy fields. Number 3. A short tick bite cannot cause the disease. Fact. The longer the tick stays attached, the greater the risk, but even short attachment can be risky. Lyme disease is common but preventable disease. Public awareness, tick prevention strategies, and early diagnosis are our best tools. There is no licensed vaccine for humans yet, but several candidates are in development. Until then, protecting yourself from the tick bites remains the most effective method. To summarize, Lyme disease is a bacterial infection spread by ticks. Early symptoms include fever, fatigue, and a bull's eye rash. If left untreated, it can affect the joints, heart, and nerves. Diagnosis involves clinical history and blood test. Antibiotics are effective, especially when started early. Prevention through tick awareness is key. That's it for today. Thank you for watching. If you found this video helpful, please give it a like, share it with friends, and subscribe to the channel for medically accurate content. I will see you in the next lesson.